Hello, my name is Karen Lay Mortiz. I'm a first-year school counseling student at Chapman University.
And my name's Kelly Stevens, and I'm a first-year school counseling student at Chapman University. We represent Chapman University's school counseling and school psychology programs. Today, we're pleased to present this video, which will provide an overview of generalized anxiety disorder and obsessive-compulsive disorder, including symptoms, prevalence, treatment options, and other helpful information for educators in the K-12 school environment in order to better support children and adolescents who may be struggling with these conditions. Generalized anxiety disorder is characterized by excessive anxiety and worry about a variety of events or activities. The degree of intensity, duration, or frequency of the anxiety and worry is out of proportion to the actual likelihood or impact of an anticipated event. Generalized anxiety disorder affects 3.1% of the US population. This is approximately 6.8 million adults. Within the youth population, there is around 1 to 3% of children and adolescents affected by generalized anxiety disorder. Women are twice as likely to be affected than men. The exact causes of generalized anxiety disorder are unknown. Genetics have been linked, but some factors that increase one's risk include stress, substance abuse, physical condition, and various environmental factors. Most treatment programs for generalized anxiety disorder are rooted in cognitive behavioral therapy, also known as CBT. CBT is an evidence-based form of therapy that focuses on teaching children and adolescents to recognize their anxious thoughts and how those thoughts relate to their feelings. CBT uses strategies like graded exposure and cognitive restructuring, which allow children to build coping skills by facing anxiety-inducing situations, recognizing negative thoughts and feelings, and replacing them with more positive, realistic beliefs. CBT-based programs are designed to support children struggling with generalized anxiety disorder. Some programs in K-12 education include the Friends program, Coping Cat, and Cool Kids, among others. With proper implementation, these programs can be administered to students school-wide, individually, or in small groups as appropriate by school-based mental health professionals, such as school psychologists and school counselors. School personnel can also support students with generalized anxiety disorder by teaching them coping techniques such as breathing exercises or meditation, and providing classroom accommodations like extra time for test taking and classroom transitions. It's easier for kids and teens to get treatment for generalized anxiety because schools provide these services for students. Studies show more than 70% of mental health treatment for kids is provided by schools. Schools have daily contact with students, and they manage anxiety with school interventions, psychoeducation, and counseling. Adults are more likely to take medication such as Lexapro, Paxil, and Zoloft for treatment. Studies show that SRIs have a large effect size for adults and a moderate effect size for children. This is important information for anyone who regularly interacts with children and adolescents to be aware of. The more people who know about the signs and symptoms of generalized anxiety disorder, the more individuals will get access to support and resources. Thank you for listening, and please pass along this resource.
All right, and moving on to obsessive-compulsive disorder. Obsessive-compulsive disorder is characterized by repetitive thoughts known as obsessions and repetitive behavior or mental acts known as compulsions. These obsessions and compulsions are involuntary and unwanted and cause a marked degree of stress and anxiety. Approximately 2% of the general population are affected by the obsessive-compulsive disorder, and the estimated lifetime prevalence among adults in the United States is slightly higher than 2.3%. The disorder is usually seen starting in childhood or adolescence, but can occur at any age. There's an earlier onset among the male population. The prevalence rate between males and females is generally the same. As for the etiology, the exact causes are unknown. However, there are factors that have been linked into OCD, such as genetics, ability to cope, increased responsibilities, other neurological disorders, and very rarely streptococcal infection. Cognitive behavioral therapy, also known as CBT, is a standard for the treatment of children and adolescents dealing with obsessive-compulsive disorder. It focuses on teaching them to be aware of atypical thought patterns and build skills to correct them. CBT strategies for the treatment of OCD include exposure and response prevention, whereby children face anxiety-inducing situations that evoke rituals and teach them skills in order to refrain or avoid the ritual behavior, in turn reducing anxiety. CBT exercises for children and adolescents in K through 12 education are appropriate for the classroom but should be administered by trained mental health professionals. Classroom accommodations individualized to the child's needs can also reduce anxiety and support optimal learning for the children and adolescents with OCD. Researchers have found that it is difficult for school psychologists to administer intensive therapeutic services due to their large caseload. Some schools use exposure therapy with students, but that may disrupt learning, and although not proven, it may negatively reinforce anxiety within the school. It is most common for schools to adjust the environment in order to treat a student with OCD, whereas exposure therapy and CBT are effective and specific in treating adults with OCD. Because OCD usually starts in childhood and adolescence, this information is especially helpful for educators and practitioners so that more students who demonstrate these signs and symptoms can be connected to support and resources. Thank you for listening, and please share this resource.